Okay, so we're going to be talking about the pericardium and the external features of the heart. Let's ignore the objective. Let's just focus on the contents, like every single point, so we miss nothing. So we're going to be talking about the projections of the heart, the surface projection uh, of the great vessels and the anterior chest wall, all of that. Now, let's start with the SVC. What's SVC? That's basically superior vena cava. Now, what two veins join together to make the superior vena cava? We have above it right here, the right brachiocephalic vein and the left brachiocephalic vein. Okay? The superior vena cava goes down towards the right atrium. Right atrium, you have here a valve. What valve do you have here? You have the tricuspid valve. Tricuspid valve, blood goes through it. Now it's at the right ventricle. Right ventricle pumps towards the pulmonary trunk. PCR is pulmonary trunk. Through the pulmonary trunk, goes to the pulmonary arteries and then to the lungs, and from the lungs to the pulmonary veins, which bring it to the left atrium. Now, all of what I just said right now, it's not in the anterior view, that's why it's not labeled in the image. After it goes to the left, to the pulmonary veins, it goes to the left atrium to the left ventricle right here, left ventricle to the aorta. You have parts of the aorta. You have arch of aorta right here. Let's use a different color and clear up the area. You have the ascending aorta right here. You have the arch of aorta, and then you have descending aorta. Now, the ascending aorta right here, you have two branches, which are the right and left coronary artery. So, two branches, RCA, right coronary artery, and LCA, left coronary artery. Then you have the arch of aorta. Arch of aorta has three branches. Let's start from the left side. Left subclavian over here. Left subclavian artery. Right subclavian artery. Not right subclavian, I mean left common carotid artery. And you have the brachiocephalic trunk. Now, the brachiocephalic trunk itself, it has two branches. It has the right subclavian artery and the right common carotid artery. And obviously here you have the apex of the heart. Let's go a bit deeper into the surface projection of the heart. You have something called the precordium. Precordium is a part of the chest wall that is directly over the heart. It's immediately overlying the heart. Okay? So basically, here's the heart. Here's the heart. Okay? The skin right over it, right over the heart, or like the layer right over it. That's the precordium. Alright? Now there's something called apex beat. It's basically the pulsation of the apex beating. Alright? It's the most distinct pulsation of the heart. You can hear it, not even hear, you can feel it using your palpating hand. Now, what does a palpating hand mean? It's the hand that does examination. You put that in the precordium, specifically at the fifth intercostal space on the midclavicular line, and you'll feel the apex beat. Now, you have to know the medical term for the anterior side, or the view that you're looking at right now. So that side is called sternocostal surface. Why is it called sternocostal surface? Because right behind that surface you'll find the sternum and you'll find the costal cartilage. Now let's talk about the pericardium. Now we have the parietal pleura. That's not part of the precardium, but that's for the lung. We have the fibrous pericardium. That's the most outer layer of the pericardium. It's the toughest as well. You have the diaphragm. Diaphragm is a muscle that helps with breathing. The diaphragm is connected to the pericardium through a tendon, to the fibrous pericardium, not the other layers, just the fibrous one through a tendon. And then you have the phrenic nerve. Now, the doctor emphasized, uh, a question he gave to the past batches or batch, and they all said it's phrenic nerve. Now, phrenic nerve was the wrong answer because I think the question was asking about which nerve innervates the heart. The phrenic nerve does not innervate the heart. Gotta keep that in mind. Phrenic nerve, this one, it does not innervate the heart, but it supplies the diaphragm, not the heart. Okay? So it would affect breathing, but not beating. Now let's talk about the posterior pericardial cavity. Here you have the heart removed, and then you have part of the anterior part of the fibrous pericardium removed. That would reveal the oblique pericardial sinus, which would be right here. It's right around the pulmonary veins. You have here the definition of a transverse sinus in this part. It's basically the passage between the reflections of serous layer of the pericardium around the arterial and venous great vessels of the heart. Just keep the definition in mind. You might be asked about it in the TBL or in the final. Same oblique pericardia again. Now the heart is still there. We just lift it up with the hand, with the arm, the hand, whatever you want to remove it with. Uh, it's the anterior view. Same view, but we just removed the heart physically, but not out of there. It's still connected. Now, what does this partially elevation show? It shows the oblique pericardial cavity, the posterior pericardial cavity, and the oblique pericardial sinus. So it's basically the same view minus the anterior pericardium, so you can see the cavity. The cavity itself isn't labeled in the picture, so you just have to know that it's there. Now, here's the this part, it's removed. What's this part? It's basically the posterior part of the pericardium. It was removed. It reveals the structure behind it. Now, what do you have behind it? You have the anterior esophageal pillux, you have the posterior vagal trunk, you have the esophagus, you have the anterior vagal trunk. Okay? So, another thing you need to know is that there is a type of sonogram that people do for the heart. It's not, very popular, but you can do it to view the posterior part of the heart. What they do is that they use, transvagal sonogram to just check the left atrium. They put a tube in the esophagus and they do, a sonogram through there. Now, let's talk about the pericardium. It's a fibrous sac that encloses the heart and the great vessels, the roots of them specifically. It's in the middle mediastinum. Alright, it has three layers. You have the fibrous one, which is the outermost, you have the parietal and the visceral. Visceral, from its name, visceral means organ, so it faces the heart. Parietal is just there, different names. The heart, as I said, it's gonna be the same place as the pericardia. It's in the middle mediastinum. It's within the thoracic cavity, and you have the pericardial sac around it. Pericardial sac is basically pericardium. Now, there are 8 simple stages to illustrate the pericardium. I don't think we need all of them, but what we need is that uh, the balloon is basically the pericardium, and your fist is the heart. You push your fist in the balloon, and you keep going, until it's all in there. You can't push it anymore. It's completely covered. Now, the lead layer over here, that is, facing your hand, that's the visceral layer. It's the one that's gonna be facing the heart. And the other one that's not facing it, that would be called the parietal layer. It's the part that's facing away. This space here is called the pericardial cavity. Now, replace everything with the actual anatomy of the heart of the human. You're gonna have a fibrous pericardium that was not in the balloon. Here they said it's a brown lunch bag. We don't need that. Just know that it's the fibrous pericardium. The fibrous pericardium is attached to the heart around the great vessels. So the great vessels are right here. They're attached to it there. There, that's where it's attached. It's not attached to the heart, it's attached there. So it's just like a bag that's attached above it, not on the heart directly. The serous pericardium, it basically is the balloon that we talked about. The parietal away from the heart, this blue one, and the visceral, which is this red part. Alright? There is still the cavity over there. Now, the fibrous pericardium, how is it attached to the diaphragm? It's not just, complete fibrous from down here. There's no fibrous pericardium on the diaphragmatic surface of that. Diaphragmatic means just the inferior surface, the one that's down. Okay? There's a central tendon of the diaphragm right there. That's what's connected to the fibrous pericardium and is right under the heart. Now, we're gonna be talking about a bit of embryology. Dr. Paul will obviously gonna mention this again, but let's understand it now so it'll be easier then. You have an endocardial tube. It folds, all right? The folding creates a space right here. That space is gonna be our transverse sinus, okay? So this space right here, that is the transverse pericardial sinus. And the oblique one is gonna be about around it. It's like almost right here in this space, okay? You have to know that the arterial pole is more anterior compared to the venous one. Here's a bit, the picture again, but with labels. Primitive ventricle with the anterior pole, arterial, not anterior, it's on the anterior surface. You have the venous pole, which has the primitive arteria, and we have some takeaway concept from here because there's a lot of information, a lot of pictures. It's a bit confusing. So I made it simple. Here's the takeaway concept. It's basically the folding of the endocardial tube. It gives rise to four things: the primitive atria, the primitive ventricle, the transverse pericardial sinus, and the oblique pericardial sinus. Okay? Also know that the arterial pole is anterior and venous pole is posterior. Another thing that I did not write here: anterior pole, primitive ventricle, venous pole, primitive atria, and focus on how it's plural. It's both of them. Now, this is a bit, this is a picture of the transverse pericardial sinus. You can basically put your finger through it. The aorta and the pulmonary trunk are gonna be anterior to your finger, and posterior to it, you're gonna find the superior vena cava and the pulmonary vessels, or veins, not vessels. So here's a picture to show the oblique sinus because you can't see it here, nor in this picture, but the green tube represents the transverse sinus. You're gonna see that the oblique sinus is behind the pulmonary vein. Here's one, two, three, four. It's right behind them. The transverse pericardial sinus is important. It's more important than the oblique one. It's basically you can clamp the surgeons, not you obviously, the surgeons clamp them, the big vessels, aorta and the pulmonary trunk, so they can stop the direction or divert of circulation of blood, so they can perform cardiac surgery, such as bypass of the coronary artery and grafting. Here's a quick summary. Let's go through it quick. Transverse location is the arterial venous sleeves with pericardial reflection. You have the anterior surface. It's gonna be, anterior to it, you're gonna find the ascending aorta and the pulmonary trunk. Let's focus on ascending over here. Posterior to it, you're gonna find the superior vena cava and the atria. Superior to it, which means above it, you're gonna have the bifurcation of the pulmonary trunk, meaning that it's gonna become two pulmonary arteries, and under it, you're gonna find the upper surface of the left atrium. Now, the oblique one, it's behind the base of the heart, within the venous sleeve of the pericardial reflection. Okay, so it's behind the base. The base is gonna be the left atrium. Now, anterior to it, see, as I just said, it's behind the base, so what's gonna be in front of it, or anterior to it, it's gonna be the left atrium. Posterior to it, which means behind it, it's gonna be the pericardium, specifically the parietal layer. Superior to it, which means above it, it's gonna be the upper part of the left atrium, and to the left, you're gonna find the left pulmonary veins. To the right, you're gonna find the right pulmonary veins and the inferior vena cava. Now here's a compare and contrast of the parietal and serous pericardium. Parietal pericardium is adherent to the fibrous pericardium, but the visceral one is adherent to the actual muscles of the heart. It's adherent to the myocardium. The parietal pericardium, somatopleuric mesoderm. The other one develops from splanopleuric mesoderm. Now, we don't know what these are just yet, but just memorize them. Somatopleuric mesoderm, that's parietal, and splanopleuric mesoderm is just visceral. Now, the parietal pericardium, it's innervated by somatic and it is sensitive to pain. Okay, but the visceral one, it's innervated by the autonomic, not the somatic, the autonomic, and you cannot feel any pain on the visceral layer. It's insensitive. So technically, you could, tickle a patient's heart and he would not feel it if you remove the fibrous or, the parietal cardium. Now, the pericardium, what does it separate? It separates the oblique sinus from the esophagus. So what would be right behind it? right behind the oblique sinus, the parietal layer, or the pericardium, and right behind that pericardium you'd find the esophagus. Now, let's talk about the nerve supply. The fibrous pericardium is supplied by the phrenic nerve. He talked about the phrenic nerve a lot, so high chance, high yield, he's gonna ask about it. The phrenic innervates both the parietal and the fibrous pericardium. That's why you feel pain in them. Now, pericarditis, it originates only in one layer. It's basically an infection of the pericardium. It originates in the parietal layer only, and the phrenic nerve is the one that's responsible for transmitting the pain or the signal from there. Now we're going to talk about the blood supply. The pericardial is, the supply is derived from, multiple places. Now let's do mine instead of, this boring text. Now it's innervated by the thoracic artery, the pericardiophrenic and muscophrenic. They're basically branches of the thoracic artery, if I'm not correct, but they're branches of them. Bronchial artery and the thoracic aorta. Okay? Now the veins for the pericardial, where do they drain? They drain straight into the azygous system. You're not required to know what azygous is, but you're required to know that the veins drain into the azygous system. Now we're gonna talk about the surface and borders. You have four borders and four surfaces. Now let's talk about in the anterior view. This is the anterior view. You find the anterior surface. Actually, you have five surfaces, including anterior. You have the upper border, which contains parts of the great vessels. Uh, the right border over here, this part, right border, it forms a part, it forms a part of the pulmonary surface, which you can see right here, the right pulmonary surface. It forms a part of it, and it contains the right atrium. Now, if you go to the left border right here, it has part of
Okay,
the
so I had something to do. Let's go back to the left border. The left border, what does it have? It has part of the left ventricle, part of the left pulmonary surface. So this one, basically a part of it is going to be the left border. Now, we're going to talk about the inferior border. The inferior border just has the right ventricle. You can't see anything other than that in the inferior border. Now, there's something called the acute margin and the obtuse margin. Keep in mind that the inferior one is always going to be acute and the left one is going to be obtuse. I'm thinking it means that obtuse is basically, the left border takes a big, bigger than normal, and inferior border takes smaller than normal, as in, margin. But we're not required to know what that means, just know that the left border is the obtuse margin and the inferior border is the acute margin. Now, to the surfaces, you have the base. The base is just the left atrium, pretty simple. Now, the left pulmonary surface, it's part of the left ventricle, and the inferior surface right here, it's part of both ventricles, not just, right, left, it's both of them. And we have here the right pulmonary surface. It is the right border, part of it is the right border, and it has right atrium and the vena cavas, the superior and inferior ones. Now, this is basically, four borders. They're not actually four surfaces, they're five because, we have the anterior one. We're gonna go quickly through the anterior surface now, the structures there. We already talked about the subclavian arteries, but, and the common carotid and the brachiocephalic and what does it branch into. But this picture just, shows it better. Now here's the aortic arch, the AA. This is the ascending aorta over here. We're done with that one. There is a ligament between the arch of aorta and the pulmonary trunk. Okay? It's called ligamentum arteriosum. We have the left pulmonary artery, coming from here. This is a bifurcation of the pulmonary. Right here, that's the bifurcation of the pulmonary trunk. You have the left pulmonary artery, and here we have the right pulmonary artery. Going down, we have the left auricle right under the not, it's a bit beside towards, the left of the pulmonary trunk. It's called left auricle. Auricle is like the ear, the little meat hanging from your ear. That's called auricle. Looks like an ear. We have the right auricle right here, this part specifically, right auricle. We have the right atrium right under the right auricle. We have the coronary sulcus. Now, the coronary sulcus contains two important vessels. It has the right coronary artery and the small cardiac vein. That's important and it's going to be repeated later. The right ventricle, right here, pretty obvious to see, it's basically the one taking most of the anterior surface of the inferior and superior vena cavas. What else do we have here? We have the left ventricle, we already talked about that, and then we have the anterior interventricular circus. Anterior means in front, interventricular means it's between both ventricles. So that's ventricle number one, that's ventricle number two. That's the space between them, and it's anterior. So it's anterior interventricular sulcus. Now, what does that? Every sulcus contains vessels. That's why it's there. We have the what? Great cardiac vein and the LAD. LAD over here. This picture, shows it a bit better. It's the anterior interventricular branch of the left coronary artery or left anterior descending artery. LAD is pretty much, enough for anyone to, know what you're talking about. Here's the coronary sulcus. It has the right coronary artery and the small cardiac vein. Now, obviously, this part is not just the coronary sulcus. Coronary sulcus actually goes like, all around, the atrium and the ventricle. It's right between them. If you want, the name here, what is it? Right arterioventricular sulcus. Here we're focusing on the right part only. But coronary sulcus also called atrioventricular sulcus, which means it's between the artery, I mean not the artery, the aorta and the ventricle. You have the right coronary artery here, RCA, and the small cardiac vein, as I just said. Here we have the anterior interventricular sulcus, means it's between, between the ventricles. It has the great cardiac vein and the LAD. Let's go to the posterior surface now. We already talked about, I'm not going to repeat them again for the sake of time. Now, the left auricle over here, left atrium, better view of them. The left atrium was not visible in the in the anterior one, but it's, visible here. This is the left atrium. Here are the veins, right pulmonary veins, left pulmonary veins. You have the left ventricle, better, side of it. Now, what's new here? It's the coronary sulcus. Coronary sulcus, it's, drains into the right atrium. It's the drainage system of the heart. We have the apex, which is basically just this point. Coronary sinus again. See, coronary sulcus, which is, just a vein that drains the heart. Sulcus terminalis. Now, this one's going to be mentioned in the internal features. It's what, under it, it's basically the landmark on the surface that tells you now under here you're gonna find the cristae terminalis, which has the SA node in it. If you go towards the inferior, now we're looking at the heart from under, from the view of the diaphragm. You have the coronary sinus again, which is, important. It has to be mentioned more than one time. You have the crux of the heart and the posterior interventricular sulcus. Now this one is posterior. It's different. It has what? It has pia and the middle cardiac vein. Pia determines dominance. It's, as you can see here, posterior interventricular branch of the right coronary artery, because this heart is just right dominant heart. Pia determines dominance. If it's from, if it's branching from the right coronary artery, then what is it? It's a right dominant heart. If it's branching from the left coronary artery, then what is it? It's a left dominant heart. And you have here the same sulcus that we talked about, posterior interventricular sulcus. In it, you'll find the middle cardiac vein and the pia. Now, crux of the heart. Crux of the heart is basically where the atrial and ventricular and AV grooves meet, where the grooves, not the atria itself and ventricle itself and the AV itself. No, the grooves of them meet. It's mainly a landmark there for surgeons. This is the crux. You'll find the grooves here. Let's go from there and there and there. Now, everything here I just said, except the coronary sulcus marks the annulus fibris that supports the valves. Now there are, for the coronary sulcus, we said there's a right side, contains RCA and small cardiac vein. Left side contains LCA, circumflex artery, great cardiac and coronary sinus. You have the LAD and the anterior interventricular sulcus and the great cardiac vein. Now the posterior part of the interventricular circles, you have the pia and the middle cardiac vein. Now, the location of the coronary one, it's where between atria and ventricles, all around circumferentially. So it's like a crown. That's why it's called coronary. And interventricular means between ventricles. So it's between the right and left ventricles, and it's anterior. Okay. And this one is just the same thing but posterior. Now we have the borders here. You have to be able to identify them. Blood is gonna look white, and that's just, what you need to know from here. You can see the superior vena cava. You can't actually see it, you just gotta know it's there. The right atrium, the inferior vena cava. Aortic arch is gonna look like a knuckle. So first part of the knuckle is gonna be aortic arch. Then right under it is gonna be the pulmonary artery. Then it's gonna be left atrial appendage. It's not always seen, but it's right there. So if you see two knuckles, know that, two parts of the knuckle, know that it's aortic arch and pulmonary artery. Then you have the left ventricle, and then you have the diaphragm right under it. This part, big one is the diaphragm, the apex of the heart right here, and then this white, not white, this black part is the stomach, empty part. Now, this guy, he's in, visible shock. Then the neck veins, they're distended. He has a decreased atrial pulse pressure, and, he has venous pressure. It's elevated. What's most important is that he has excess fluid pressuring the heart. There's something called pericardio synthesis. We're gonna go into that right here. So, the pericardial infusion and cardiac tamponade. Pericardial effusion means that there is excess fluid, whatever type of fluid it is, blood could be, pus could be, serous fluid, anything. It's accumulating in the pericardial cavity. The rapid accumulation of that just, it causes impairing in cardiac filling. It leads to low cardiac output and sometimes cardiogenic shock and death. It's also referred as cardiac tamponade. So either pericardial effusion or cardiac tamponade. Both are the same thing. Now, how do you deal with the pericardial effusion or, cardiac tamponade? There is something called pericardiocentesis. You put a hole in the pericardial cavity and you suck the fluid out. It's basically a surgical puncture. You put it through the fifth intercostal space, left to the to the sternum. So you can see, look at the sternum. You go towards the left of it, and then you go towards the fifth intercostal space. You pass the needle like 1 to 2 centimeters to the left of it at an angle of 45 degrees, straight to the skin. Then you go up and backwards. The needle, while it's inside, you push it up, then backwards. The tip of it is, it's gonna enter the pericardial sac until you feel that it enters the pericardial sac. Then you get the fluid out. Now, there is something called a cardiac notch. Because of that cardiac notch, the needle misses the pleura and the lungs. It only penetrates the pericardium, which is what we want. Now, you need to know, what does the needle penetrate? First, obviously, it's gonna penetrate the skin. That's like, your most superficial surface. Now, talking about superficial surfaces, you have the superficial fascia, alright? Right under the superficial fascia is the pectoralis major muscle, or pecs. Remember it as pecs, you're gonna know it when you see it in the choices. Then you have the external intercostal membrane. Know that the external one is a membrane and the internal intercostal is a muscle. So external intercostal membrane, then you go towards the internal intercostal muscle. Behind that internal intercostal muscle, what do you have? You have the thoracic cavity. So the muscle there would be transverse thoracic muscle. Right under that thoracic muscle, you'd finally enter the fibrous pericardium. And what's under the fibrous pericardium? The layer that we're targeting, which is the parietal layer of the serous pericardium. Now, this is basically a bunch of diseases that could happen to the pericardium. So, you have the pericarditis, which is basically an inflammation of the pericardium. Then you have pericardial rub and pericardial effusion. Pericardial effusion is just excess, excess fluid, any type of fluid, pus, blood, all of that. It compresses the heart. Now, why is the pericardial effusion bad? It compresses the heart, making, the heart is compressed, can't, fully expand, and it's gonna be ineffective. Now, the non-inflammatory pericardial effusions, they're, congestive with heart failure. Venous blood returns to the heart at a rate that exceeds cardiac output. So, when venous blood returns to the heart at a rate faster than the cardiac output, that's non-inflammatory pericardial effusion, and it produces what? Right cardiac hypertension, which means, more pressure in the right cardiac side. And that's it for the pericardium. You might want to check out the pericardial friction rub. It's basically no sound. There's just, there's no sound. That's it. That's all you need to know. Because chest pain, there's just no sound. You don't need to know more than that. When you listen to the stethoscope, it sounds like rustle of silk. The doctor did not really talk that much about pericardial rub. You can just, it's basically, let's just talk about it for the sake of, what if it was mentioned. It's, the thickened pericardium, it's chronically inflamed and may calcify, hampering the cardiac effect, and it's gonna, give off that sound. And that's it for pericardium.